Hi, welcome to Ortho Evidence. I have the pleasure of introducing a colleague, a friend, and someone I know who can enlighten us about sort of the leadership issues facing another country. Let me introduce Sultan al Maskari, who is the president of the Orthopaedic Society of Oman and also head of orthopedics at one of their large institutions there. Sultan, welcome.
It's nice to meet you again, Mohit, and it's nice to join the Ortho Evidence community and share our experience in Oman. And I think Oman is no different from most countries that are living in the modern world with modern day travel and telecommunications and the impact of the goods and the negative aspects of modern day travel, of the rapid spread of COVID-19. However, the situation with us is somewhat different from other countries, as can be expected. I think every country has its own unique aspects. The spread here has largely been contained fairly well from the beginning, but we have not peaked yet. I think what happened is that on the arrival of the first few cases, which came in through travel, the country immediately and the government put the screening motion into action, the screening initiatives into action, and people were screened and quarantined either within their homes or institutional quarantines, and later on started testing. Also, voluntary quarantine for people was recommended from the beginning, so we've had that for quite some time. But mandatory quarantine has been enforced for 3 weeks now. Only essential workers and only 30% of each establishment's essential workers are allowed to go to work. And unfortunately, recently, since last week, some hotspot areas were identified where community transmission of the disease started overtaking the travel transmission. And those areas were put wholly in quarantine, and mass testing of certainly anybody who is symptomatic has been introduced. On the positive side, of course, is that the government has also acted largely to reassure people, because Oman has a large non-Omani population, almost 50% or just under 50% of the population. Certainly in Muskat, 50% of the population is non-Omani, and they have been reassured that their treatment costs will be borne by the government. So that has helped in assuring people to come forward and for screening and testing and treatment if necessary.
I was just going to ask you, like, when you say the word, like, so, like, for example, India right now is entering into a full formal lockdown, which is near quarantine level, which is people are in their homes and they're basically, if they are out, found for any, except for an extreme reason where they have to be out, they're ticketed, fined, and they're even suggesting jail time in some of these areas. So let me ask you this. On the scale of physical distancing measures, how do you rate what's happening in Oman? Is it more of a use judgment, stay home, physical distance, or is it much more a stronger enforcement of that staying home?
It's somewhere between the two. Most of it is actually stay home, keep safe, keep distance. But also, if a person is quarantined and they violate that quarantine, then there are laws that subject to that person to prosecution, a fine, and even carries a prison sentence. Also spreading false rumors, because a lot of false rumors have taken hold, unfortunately misinforming people and sometimes frightening people. The government has taken action against that. But we are in lockdown, but not fully, completely locked in your house yet.
No, fair enough. Yeah. So how is this, I mean, you know, you are currently president of an orthopedic society. You're also head of Department of Orthopedics. Surely orthopedic care and orthopedic education has been dramatically changed. I mean, I imagine anywhere from shifting to canceling meetings, virtual conferences, but at the level of the hospital, What's happening? I mean, how much have things changed? And under the understanding that it's likely that if you're in this moment, you're likely also facing major restrictions in who's getting procedures and who ultimately is going forward with emergent surgery. Can you give us a flavor of what's happening in the hospital system?
Oh, absolutely. Our hospital is one of the larger hospitals in the country, and of course, it also has been assigned as a COVID-19 receiving hospital in association with other hospitals. So for now, a month, no elective surgeries have been allowed, and only urgent procedures where there is a clear advantage of operative intervention over non-operative treatment. Certainly, any procedure that might require intensive care unit admission has to really be justified and discussed with other colleagues, the anesthetists and the infectious disease team that's leading the campaign. So in that regard, we're no different from most other systems where elective procedures have been stopped. In terms of trauma, we're taking in traumas, but of course, with the lockdown, a lot of the heavy trauma has stopped, except for the odd case where somebody who is irresponsible goes and maybe crashes his motorbike or so, usually young people, but that's rare. Other usual low energy trauma and so on is going on. What we have noticed is actually, and this is, I don't know, it has been replicated in other hospitals as well. Even traditionally domestic trauma of the low energy insufficiency fractures have gone down dramatically in our experience. What's different between Oman and most of Western Europe and Northern American countries is that we don't rely heavily on nursing homes. So elderly people usually stay with the extended family. And we think probably might be the fact that their sons or daughters are spending more time at home, probably taking more care of them. So that might have impacted that. That's an area that we have noticed, and we're going to audit and gather data on.
On that point, Sultan, let me just dig a little deeper, because you're right. I mean, the one thing that we have seen in other countries has been decrease in multiple trauma, simply because there's no one on the streets. But because there are still nursing homes and and rehab centers for that fragile elderly population with osteoporosis, we are seeing continuing hip fractures. The difference has been hip fractures are coming in, or insufficiency fractures are coming in, COVID positive, and that becomes the new challenge, is how do you manage those people? But it seems to me you're saying quite the opposite in terms of a trend, which is actually a fascinating point. In fact, in some way, this in itself is an experiment that if, at home, if there is more potential surveillance, we can actually, I mean, that in itself can be a primary prevention factor across all the other medications and people are talking about. This itself is an interesting experiment that's happening.
Absolutely, and you've put it there in better words than I could, which is surveillance at home. And the other thing that we notice, of course, and because of the extended family culture that we have in Oman and many of the Eastern countries, I think, is the moment that the public media, mass media, reported that the elderly are the most vulnerable to this virus. Most families actually cocooned their elderly, and as a result, we have not admitted a single patient, elderly or otherwise, that needed surgery who is COVID positive. So that's a different experience that we have in Oman.
Wow.
Yeah.
Yeah, that's a dramatic difference. Yeah.
Absolutely. We have COVID patients in an isolated ward and separate ward, and we have I think they've admitted 1 or 2 patients in intensive care unit, but they've all been discharged. So that's another thing that we're noticing, that we don't have as high an admission rate in intensive care. Also, the community rate, we don't have the exact data for the whole population because we have not tested everybody, but the overall incidence of COVID-19 cases in Oman until today is 813 confirmed cases. And
Okay.
the total population of Oman is about 4.5 million. So that's quite a low carry rate. And
Right.
most of those cases, I'd say over 90% are in Muscat. So even if you put that within the perspective of the Muscat population, that probably comes down to less than 1 in 1,500
Yeah.
cases of carrier cases of COVID-19. But that's, of course, we haven't tested the whole population. But those two things that stand out is that the reduction in the low energy insufficiency trauma, and the fact that none of these patients is a COVID positive. So
That's
our results.
fascinating. Yeah. And let me just take it one step further. So right now, even though there seems to be relatively under control. I mean, if you look at other countries, you look at what's happening in Spain, look what's happening in Italy, US particularly, and even in France right now. I mean, they are in a crisis mode and trying to various stages of the crisis. You have suggested, I thought I heard that you had suggested that for at least the next several weeks, there'll be no elective practices in the hospital. So you're on this sort of triage of only the most urgent and emergent cases come through. Do you have any guidance in from whatever authorities that are going to be making these judgments in the hospital system or in the country around when you can feasibly see a return to elective procedures? I mean, is there a date? I mean, I can tell you that it's ranging on who we talk to. I'm curious if you've got any insight.
And at the moment, no, things are kept on an open-ended situation because we don't think we have crossed the peak of the curve yet.
Right.
The numbers are still fluctuating, and actually, since they identified those hot spots and they started mass testing, the numbers have increased.
Sure.
But they are still under control. The maximum that was recorded on a daily basis was 128, but today it's much less than that. I think it was 88 or something like that. So our numbers are still manageable in many ways, but the fear, of course, is that the situation, if it gets out of control, then the intensive care units might not be able to cope. Therefore, the government is taking really a preventive approach, and the Ministry of Health.
Yes.
We have a committee to manage this, and they are guiding.
So right now, I mean, with relative assurity, it seems to me you don't expect to be returning to any sort of elective practice patterns that were typical prior to COVID for the next 2 months. So let's say April, May, June, July, or is it possible it'll keep going? I'm just curious if you have any sort of vision on this.
I honestly don't have any sort of vision, but I think the expectation is that probably we will peak by the end of April. So if you give it at least 2 weeks, so I really don't see us going into elective procedures before mid-May, June. And then, of course, Oman is a majority Muslim country. Then we have Ramadan coming up in another 10 days' time. And usually during Ramadan, many people do not wish to undergo elective procedures because there is a festival at the end of it and so on. So they prefer to wait. So really, I think we're looking at June when we can start our elective work again.
And everything's so dependent on what happens, I guess. So it's a moving target.
No, the other thing that certainly for us being a teaching institution, education has been affected hugely, tremendously. And the clinical aspect of teaching has been affected. We have tried to compensate for that using platforms and apps like GoToMeeting and Zoom and so on. And that has worked quite well to a large extent. And that as well, we benefited from that experience in the sense that we could see the strength to which one can utilize remote teaching. And it has been received very well by our students, and certainly the arrangements that we have put in place, which I think are no different from most other institutions around the world, seem to be working to a certain extent. However, there always remains the fact that you need to have the trainee or the student in direct contact with the patient. And how are we going to resolve that, and when? God only knows.
Yeah, and I think that is the big challenge. And it gets back to this whole point, right? Which is virtual care, I think in many ways has seen hundreds and hundreds of percent-fold increase in its popularity, largely because what we're doing right now, we likely wouldn't have done in other faces. I would have looked to either meet you or call you, but we're doing this and we're realizing it is pretty facile to do. However, I don't think that you as president of the Orthopedic Society would think that a virtual meeting would replace the value of a face-to-face meeting. So on that note, presuming that there's probably moved to a lot of these meetings, what do you think we're missing out, with the virtual communication? One of them I think you highlighted already, which is it's hard to do virtual consultations in orthopedics where it might be easier in other primary care areas because physical exam is such a fundamental, important part of the orthopedic consultation that it's very difficult to make decisions without that. But in the education forum, what do you think's missing? So there's a lot of popularity, the big virtual events. Every association has moved to a big virtual event. I suspect you're probably thinking the same. CCOT as example, we're both talking about the same. What will be missing from that, though?
Oh, there's always the personal contact, the fact that you can sit down with your colleagues, have a direct chat without somebody else listening to it. Maybe for instance, when was the last time we met? And if I see you, I would like to go and have a drink or a cup of coffee or something like that.
Right.
And sit, just have that. I think that's very, very important for meetings. I think that side is extremely important. Of course, there's also the face-to-face discussion without feeling any restrictions or inhibitions because you're on an open platform and so on. That's for the educational meeting. So I think while we could do a lot, I think the way I look at this experience, like most people, I think there are negatives, huge negatives, of course, and the loss of life cannot be replaced. And all that we can say is that thoughts go to those people who have lost loved ones. However, there are lots of positive things that have come out of this experience in that it has shown us what we can do and the resilience of the human mind and people to cope with this adversity. And that we can actually learn many lessons and maybe save costs, save lives, save travel, and so on. Maybe utilizing a facility nearer the patient. Oman is quite a large country physically with a small population. So while in the past, I expected my patients to travel maybe 200 kilometers or even more to come for a 15-minute consultation. Now it brought to me, what if I actually arrange with a colleague in a local health center or a clinic where the patient can go and have a video consultation in the presence of another colleague. So looking at it from the patients and their relatives' perspective, I think it opens up huge possibilities and lessons for us to move into the future.
Well, let me ask you this. I mean, you are looking at the world through many, many lenses, I'm sure. When you look back, and as I know many of the individuals I've gotten to respect and admire, individuals like yourself, take this as a moment of reflection. So I'm sure you've reflected on what this means and what this means for the future. If you were to think about parting messages to the world about what this means for you on a personal level and also maybe on a broader level, if you've reflected to that point, which I suspect you have, what message are we supposed to get from this period in time?
I think there are a lot of messages, and now actually with the elimination of the physical travel for work and so on, one has much more time to sit and reflect and read and think and so on. And a lot of things that we have taken for granted. For instance, international rapid travel and mass travel. We've always taken it for granted that it's just simply a positive thing. We never thought about its impact on the environment. We never thought that an airplane can carry vectors, viruses, and so on. And within a few hours of the first case being reported in wherever it is, as it happens this time, it's in Wuhan, in China, but it could be anywhere. And within less than 24 hours, that virus or germ could be in different continents around the world. Also, I think the impact on the environment is something that this experience has highlighted, that how quickly nature can recover and how much damage we have done. I think also our own families, within our professions, that we can do a lot with minimal environmental costs, with minimal carbon footprint, and we need to think probably more about that. In terms of education, probably recording, keeping our, documenting our talks, our lectures, our cases and so on for people to access. I think also this has brought the goodwill from many corners where organizations, companies that, given the circumstances, we are giving you free access to your knowledge that in the past. And I think if we continue in that, that's probably something that will be, it's a positive thing that will come out of this experience. On the other hand, it has shown that how much ill prepared with we were on coping with something like a virus. And this has been highlighted, of course, initially by Bill Gates, and I think you've quoted him on that and in your nice article recently, and you'd share that. And the real enemy is pollution, is germs and so on. And we are spending a lot more money on weapons to kill each other instead of actually fighting things that actually are a threat to all of us. And this virus has exposed the vulnerability, even the most powerful people, the most wealthy people, the most famous people around the world, along with the poor ones. And I think it has given us and our leaders more than anyone else time, an opportunity to reflect on where to prioritize our resources.
Well, I mean, when I look at this and I hear you speak, I think I reflect on so many insights that you have that I don't think often get the time of day, because we're so caught up in the crisis and the misinformation and the info epidemic of misinformation, that it's nice to actually have a moment of clarity with a colleague and a friend. And I can't thank you enough, Sultan, for taking a little bit of time and giving us some insights from Oman. Thank you so much.
Thank you very much. And I actually thank you as Mohit Bhandari and Orthoevidence for actually countering that misinformation by putting the evidence available for all of us to go through. And I really cannot thank you enough for all that hard work and your team. It has been a real pleasure. Thank you, Mohit.